Hello, and welcome to our presentation for the Wales ExChange Conference Program. Thank you for joining us. This presentation is titled Learning from Domestic Homicides and Suspected Victim Suicides During the COVID-19 Pandemic. I'm Katie Hoger. I'm currently a research fellow with the Vulnerability Knowledge and Practice Program, working on the Domestic Homicide Project from which the findings presented today are drawn. I'm also completing my PhD at the University of Oxford Centre for Criminology, and my research looks at how the police and multi-agency partners have navigated the criminalization of coercive control, which I'll mention later in this presentation. So now I'd like to turn to my colleague at the VKPP, Tien Trang, who is presenting alongside me today to introduce herself.
Thanks, Katie. Hello, everyone. I'm Tien Trang Nguyen Phan, and I am a research assistant with the Domestic Homicide Project with Katie. I have been working in the domestic abuse sector for over 12 years, and I have recently completed my PhD on mothers' experiences of abuse by their adult children.
Thank you. So first, I will begin with an overview of the project, just to give you all some background on where this analysis comes from. So this project was set up by the National Police Chiefs Council and the College of Policing with Home Office funding in May 2020 to collect data on domestic homicides and, for the first time, suspected victim suicides following domestic abuse from all police forces in England and Wales to inform our understanding of risk in these cases. And the project decided to use a wide definition, which is shown on this slide. It includes suspected victim suicides, as well as sudden, unexplained, or unexpected deaths. All forces in England and Wales submit relevant cases to our project using a template that covers suspect and victim characteristics, circumstances of the death, previously known history of police contact, and identifying the presence of risk factors. Ideally, these forms are submitted to the project within 7 days of the death occurring. However, we also complete follow-ups and check in with forces and complete data reconciliation exercises to ensure accuracy and update of the data set. The project does not simply count the number of deaths that have occurred, but also receives richer information about the circumstances of the death. Because it's drawn from what police know within an early stage after the death, our project does not replicate the in-depth review process of a domestic homicide review. However, because this project's database is updated on a quick-time basis, we were able to share rapid learning with our internal stakeholders, which brings me to the next slide. So we share rapid learning with our police partners. Since the start of the project, we have provided monthly reports to police stakeholders with more detailed information on cases, as well as some key features identified relating to risk and additional vulnerability. Additionally, our first 12-month report was published last year, and since then we have delivered presentations such as this to a variety of audiences across policing and the wider vulnerability sector. Today, we'd like to share with you these main findings, as well as some additional analysis from our first 2 spotlight briefings, which focused on adult family homicides and older victims of domestic homicide. So now I'm going to turn things over to Tien Trang to run through some of those key findings.
Thanks, Katie. So here we are. Yes. So at the time of publication of our first 12-month report that Katie mentioned, the project counted 208 incidents, resulting in 215 deaths between 23rd of March 2020 and 31st of March 2021. We have broken these down into 5 different typologies based on the relationship between the victim and the suspect, because these demonstrate different contexts for the abuse and the death. As you can see here, the most common typology was intimate partner homicide, either by a current or an ex-partner, and these accounted for almost half of the deaths, or 49%. The next largest group was adult family homicide, for example, the killing of a parent by an adult child, or a sibling-on-sibling murder. And these accounted for nearly a fifth of the deaths. We included suspected victim suicides, where there was a known history of domestic abuse. And as Katie mentioned, this project was the first time that data had been systematically collected in this way. And again, these accounted for nearly a fifth of the deaths. We also extended our definition to include deaths of children, and these accounted for 12% of recorded deaths. And finally, there was a very small group of what we call other, so where parties might have been residing together as housemates or lodgers, but there was no intimate or familiar relationship between them. So our data, alongside a reanalysis of Home Office homicide index data, suggests that there was no overall increase in domestic homicide during the first year of COVID-19 related lockdown restrictions. However, it's worth noting that these comparative figures with previous years will exclude suspected victim suicide data because no baseline for those data, for those deaths exists. And of course, each death is one too many, and the relative stability of these figures in fact demonstrates the ingrained nature of this problem. And additionally, this is only 1 year's worth of data, so we are continuing to analyze additional information to be able to identify potential patterns. And of course, it's really important to consider the circumstances and characteristics of these deaths, including differences between and within typology. As we said, there were 215 victims during this period, the vast majority of whom were female, or 73%. However, this does vary by typology. For instance, as you can see from the graph here, 85% of intimate partner homicide victims and 90% of suspected victim suicide victims were female. On the other hand, both child death and adult family homicides have a more even split between the sexes, with around half involving male victims. And so these findings really highlight the importance of context of the homicide. Now, the highest proportion of victims centered around the ages of 25 to 54, with an additional increase in the 65 and over age group. And although we haven't shown it here, there is as well a slight difference by typology there. So while it is true that the majority of victims were between 25 to 54, there was a high proportion of older victims within cases of adult family homicides. And this shows the importance of considering domestic abuse victimization over the life course. Now, where recorded, just over 3/4 or 76% of victims were recorded as white, with the next ethnic groups being Asian and Black, both at 10%. What we saw was that victims from Black, Asian, and minority ethnicities were overrepresented in our data set compared to the general population in England and Wales, according to census data. And these victims were significantly less likely to be previously known to police and slightly less likely to be known to other agencies before the homicides or the suicides compared to victims who were recorded as white. However, there were similar proportions of victims across all ethnicities that were previously assessed as high risk from domestic abuse before the death. So this suggests that victims are similarly at high risk for domestic homicide and suspected victim suicide, but that there may currently be fewer opportunities to support or safeguard those of these victims, so those from Black, Asian, and minority ethnicities. In a sharp contrast to victims, the vast majority of our 228 suspects were male, so 80%. The only typology where there is a higher proportion of female than male suspects is in child death, where 59% of suspects were recorded as female. As we can see here, the most common age group for suspects was 25 to 44 years old, making them slightly younger than victims, and without the increase in those aged 65 or over. And this reflects the characteristics of adult family homicides involving younger suspects, as we shall see later on. In terms of ethnicity, There was a similar proportion of Black, Asian, and minority ethnic suspects as for victims at 25%. So what we see there is that individuals of Black, Asian, and minority ethnicities were overrepresented as both victims and suspects in domestic homicides in our project data set. And our forthcoming spotlight briefing will focus specifically on this issue. I will now hand over to Katie to discuss some of our findings on risk factors as identified by our project.
Thank you, Tian Trang. So we asked forces to indicate the presence of 23 different risk factors for domestic homicide in relation to the suspect. So it's important to note that based on the size of the project data sample, we're not able to claim that these factors predict or are cause of domestic homicide. However, these factors were selected following a review of the literature, with some being commonly identified. So this chart shows the relative presence of these risk factors in descending order of recording by police. So the top 5 included the suspect being a previous domestic abuse perpetrator, any mental health conditions, coercive controlling behavior, and drug and alcohol misuse. And we think that many or most of these factors are likely to be underestimates, as police may not always have knowledge of whether or not they were present. Additionally, identified risk factors did vary by typology. So on the next slide, I focus a bit more on the use of controlling and coercive behavior. As mentioned, I'm completing my PhD on the police response to coercive control, including how they work with their multi-agency partners. So for anyone who might not be familiar with the term, while it's by no means an exhaustive list, coercive control relates to a pattern of abusive behavior that can involve threats, intimidation, isolation from family and friends, humiliation, denigration, microregulation of everyday behaviors such as eating, cleaning, or physical appearance, monitoring and surveillance, such as by use of phones, location tracking, and social media, manipulation, including within the criminal and family court systems, as well as actions like gaslighting. And this form of abuse may not present overt signs of physical violence. However, the threat and/or use of physical and sexual abuse are often utilized to establish and reinforce the control of the abuser, inducing chronic fear. While not all coercively controlling abusers will commit homicide, the academic literature has demonstrated an association between a history of coercive control and intimate partner homicide. Since the criminalization of coercive control in England and Wales in December 2015, the police have begun utilizing training and are moving toward wider use of a risk assessment, which focuses on identification of these behaviors. My PhD research involved conducting 59 interviews with police officers and their multi-agency partners, including those within children and adult social care. Analyzing police case files and reported outcome data, observing ride-alongs with police, as well as observing strategic and operational multi-agency meetings, such as MERAC. While I don't have time to discuss the findings in detail, all of this demonstrated the importance of practitioners understanding this pattern of behavior in order to identify it, highlighting the time it can take to develop rapport with someone subjected to coercive control, and the way in which bringing together information from multiple agencies can build a contextualized picture and even assist the police in providing evidence for a charge and conviction for the offense of controlling or coercive behavior. It was not uncommon for police officers to describe choosing to pursue alternative safeguarding measures outside of the criminal justice process, for which they relied heavily on the support of their multi-agency partners. So returning to the risk factors analyzed within domestic homicides and suspected victim suicides, perpetrator threat of suicide or perpetration of non-fatal strangulation may be used as tactics which form a part of a pattern of coercive control. Within suspected victim suicides, coercive controlling behavior and non-fatal strangulation were key risk factors. In fact, suspects or perpetrators associated with suspected victim suicide deaths were 4 times more likely to have a recorded history of previous use of non-fatal strangulation than in cases of intimate partner homicide. And over half, or 56% of suspects associated with suspected victim suicide deaths were recorded by police as demonstrating a history of coercive controlling behavior, as compared to 29% of intimate partner homicide suspects. So another one of the factors that we looked at was the proportion of suspects who were known to police previously as suspects or perpetrators of domestic abuse. We profiled each suspect according to their police recorded history And in our data set, over half of suspects in this project, or 58%, were known to police as suspects for some form of offending. And in just under half of cases, or 48%, the suspect was previously known to police specifically for domestic abuse. This includes against a partner or family member. It was highest in suspected victim suicide cases, which is perhaps to be expected due to the nature of identifying these cases, whereby the police must know about the previous history of domestic abuse in order to submit them to this project. In contrast, only 17% of suspects in child death cases were previously known for domestic abuse. And similar to intimate partner homicide suspects, in nearly half of adult family homicide cases, the suspects were known to police previously for domestic abuse. In addition to being known to police, we also asked officers to identify whether the victim and/or suspect were known to other agencies. One caveat around this data is that so early on in the investigation, police may not necessarily have this information. However, our findings show that in over half of incidents, or 57%, one or both parties were known to other agencies. This was higher in suspected victim suicide and child death. The agency most commonly listed was MARAC, with nearly a quarter previously referred. However, this will include a range of partner agencies. And regarding other agency contact, the victim and our suspect was known to children's social care in just over a fifth of cases and mental health services in 17% of cases. So notably, in 44% of cases where the suspect was not known to police, they were previously known to other agencies. So this raises the possibility of improved communication, coordination, and information sharing that could provide additional opportunities for support. Now I'm going to pass things back to Tien Trang to discuss our first spotlight briefing on adult family homicide.
Thanks, Katie. Here we go. Yes, so as Katie mentioned, for our first spotlight briefing, we chose to focus particularly on adult family homicides because they made up the second biggest group of domestic homicides in our project dataset. So just to recap, between 23rd of March 2020 and 31st of March 2021, excluding child deaths and other deaths, focusing only on domestic homicides and suspected victim suicide, our project recorded 184 domestic homicides and suspected victim suicides, and 40 of these deaths, or 22%, were adult family homicides, and these involved 40 victims and 43 suspects. As briefly mentioned before, unlike intimate partner homicides and suspected victim suicides, where victims were overwhelmingly female, there was an even split of male and female victims among the 40 victims of adult family homicides, with 20 female and 20 male victims. However, this even split will look slightly different when we break down the different relationships, as we shall see on the next slide. Now, in contrast to victims, 39 of the 43 suspects of adult family homicides, or 90% of them, were male. And so this is quite in line with previous evidence from domestic homicide reviews that adult domestic homicides are also gendered, especially in terms of perpetration. So as I mentioned previously, this even split of male and female victims of adult family homicides looks slightly different when we examine the different relationships. We can see here that the most common relationship of the victim to the suspect was a parent in 25 cases, involving 14 mothers and 11 fathers. 6 victims were siblings, brothers killed by other brothers. In 5 cases, a grandparent was killed by an adult grandchild, and this involved 4 grandmothers and grandfather. And the remaining cases involved wider family members such as nephews, etc. And so this also mirrors domestic homicide review research, which shows that when a homicide occurs between family members, it most often involves the killing of a parent and more often of a mother. So in keeping with this pattern of adult children and grandchildren killing parents and grandparents, we have 63% of victims who were aged 55 and over. And then in contrast, our suspects in adult family homicides tended to be younger, with 60% aged between 16 and 34 years old. And this then contributes to the proportion of younger suspects and older victims in our overall data set, which I discussed previously. As Katie mentioned in her previous section, our project asked forces to indicate the presence prior to the death, wherever known, of 23 different risk factors for domestic homicide in relation to the suspect. And again, why this prevalence of risk factors is likely to be an underestimate, because it is based on what was known to police at the time. Still, the following risk factors emerged as the most commonly identified amongst the adult family homicide cases in our project. Firstly, mental ill health. 15 of the 25 suspects in the homicide of parents and 3 of the 5 suspects in the homicides of grandparents were recorded as experiencing mental ill health, including 6 who were diagnosed with psychotic disorders. And this was more common and more severe than in intimate partner homicide. Secondly, substance misuse, where suspects in adult family homicides, more often than those in intimate partner homicides, were noted to have a record of alcohol and or drug misuse. And thirdly, history of domestic abuse, where almost half of the suspects were known to police for perpetrating domestic abuse against intimate partners and or family members. And it's worth noting, though, that suspects in adult family homicides were less known to police for prior domestic abuse than intimate partner homicide suspects, and that fewer of these suspects were previously deemed high risk, which may say something about how these cases were seen by police, or how dynamics or risk were understood by police in these cases of adult family abuse. And again, this really mirrors research into domestic homicide reviews, which has identified a strong presence of mental health, substance misuse issues, and previous domestic abuse, as well as my own doctoral research into mothers' experiences of abuse by their adult children. And the following case study really illustrates some of the issues that I have just mentioned. This case concerns a 62-year-old victim killed by her 31-year-old son at her address in late 2020. And this case was submitted to our project shortly after. So her son had been residing with her and her husband when the incident occurred. The suspect, the son, had a protracted history of poor mental health and had been known to police for allegations of assault against his parents, criminal damage, and arson at their home address. And at the time of submission, it was not known whether COVID restrictions might have impacted his access to any mental health support services. So what we really saw or observed from our project was that suspects in adult family homicides often have a history of mental health disorders and or substance misuse, as well as abuse against intimate partners and family members. Therefore, information sharing between police, mental health, substance misuse, and adult social care agencies is really vital to prevent future homicides in these cases. And what we then also saw is that victims in adult family homicides are most commonly the suspects' parents or grandparents, primarily mothers and grandmothers, who very often are caring for the suspects in some way. And so when individuals with a history of domestic abuse offending are released from institutional care and or prison, potential risk to their family members in caring roles, not just the suspect's own needs, must be adequately assessed. So I shall now hand it back over to Katie to discuss our second spotlight briefing.
Thank you, Tien Trang, as that leads us into another subsample on older victims of domestic homicide. So to begin with some initial figures for context, bearing in mind the relatively small sample size. So of the 145 deaths classified as adult family homicides or intimate partner homicides, 36 or 1 in 4 involved victims that were aged 65 years or older. Adult family homicides demonstrate an older victim age profile than intimate partner homicides, as mentioned, with 43% of adult family homicide victims and 18% of intimate partner homicide victims aged 65 years and older. And regarding the relationship between the victim and suspect, 19 older victims are suspected to have been killed by their partner. And within adult family homicide, older victims included 12 parents suspected to have been killed by their adult child and 5 grandparents suspected to have been killed by their adult grandchild, as Tian Trang mentioned in the previous slides. So next, looking at the sex of the victim and suspect, 78% of the 36 older victims were female, while 22% were male. In contrast, 81% of the suspects associated with these deaths were male, whereas 19% were female. As shown previously, within overall adult family homicide deaths, male and female victims each represented 50% of the data set. However, when examining adult family homicide of older victims, the proportion of female victims increased to a level similar to that of intimate partner homicide. And the proportion of male suspects remains high across all domestic homicides. So to see whether the victim age profile changed during the pandemic, the project team reanalyzed 15 years of data from the Home Office Homicide Index to create a pre-pandemic comparison. Note again that this Home Office Homicide Index is a separate data set with different methods of data collection. However, when compared with previous years, the figures suggest that the pandemic saw a rise in domestic homicides of older victims, and especially between older couples. So during the first year of the pandemic, the proportion of older victims of adult family homicide appears to have increased from 35% to 43%, and a larger proportionate increase was seen in older victims of intimate partner homicide during the pandemic, appearing to increase from 9% to 18%. So this slide presents some of the key learning from these cases. So where older victims were killed by their partners, it was also common for the suspect to die by suicide. 45% of intimate partner homicide suicides involve victims and suspects aged 65 years or older. In contrast to cases involving younger couples, older couples involved in intimate partner homicide were not typically known to police for domestic abuse. Older victims of intimate partner homicide often had serious physical and/or mental health needs, and in these cases, the suspects were commonly caregivers for the victims. Suspects of adult family homicide deaths involving older victims often had a history of substance misuse and/or mental ill health, as mentioned. So in these cases, the victims were commonly caregivers for the suspects. We also asked about insights about the COVID-19 pandemic on the circumstances of the death, and qualitative analysis identified themes around deteriorating mental and physical health, the suspect using COVID restrictions as an excuse not to access medical help for a partner or family member with serious illness, and the suspect or victim described as struggling to care for a partner or family member with a serious mental and/or physical illness based on a lack or disruption of support services. Next, to summarize just some of the key messages and practice implications relating to older victims. The initial data suggests that there were more older victims of domestic homicide during the pandemic compared with previous years. Older victims were killed by both intimate partners and by adult children or grandchildren. Victims were most often female, while suspects most often male. And these findings suggest that the pandemic and associated social restrictions may have put older victims at greater risk of harm, including domestic homicide, through disrupted or reduced healthcare and support. Agencies must prioritize continued contact with these individuals, and agencies should ensure that their risk assessment processes sufficiently recognize the risk posed to older victims of intimate partner and adult family abuse. As mentioned, suspects of homicides involving older victims were not always known to police for domestic abuse, particularly within the context of intimate partner homicide. However, the victim and/or suspect often had known care and support needs and will have been known to other agencies in some capacity. Therefore, agencies should discuss the needs of older victims during domestic abuse partnership meetings, working with older victim charities and/or care associations. Police and partner agencies should consider ways to reach out to older victims through accessible communication campaigns using a variety of methods, as in not just online or via social media. So to conclude this presentation with some of our future plans, as mentioned by Tian Trang, we're preparing a third spotlight briefing focusing on analysis surrounding ethnicity, as well as learning related specifically to suspected victim suicide deaths with a known history of domestic abuse. We have conducted deep dives in 5 forces with identified promising practice in relation to their identification and response to these deaths, alongside a survey of additional forces. Our second annual report covering the first and second year of data collection relating to 24 months of data will be published later this year. Finally, the project is now in its 3rd year and continuing data collection. So we look forward to having a 36 months data set in the future to start moving towards understanding wider trends in this data. And just to finish, if you have any questions or want to follow up with anything discussed in this presentation, please do feel free to email us here, and thank you for listening.
Thank you for listening.